Hello dear students, now we will see the latest ninth edition neonatal resuscitation program which may be used beginning from October 22nd, 2025. This is the latest algorithm that you need to write in your exams or you need to know before attending neonatal resuscitation. So the changes are, these things remain same from the 8th edition: antenatal counseling, team briefing, equipment check, while the birth and initiate cord management plan have been added. Then these three questions remain the same: term, gestation, good tone, breathing or crying. And after that, this thing is optional here. If needed, only you have to clear the airways, otherwise these steps remain same. Then here is another change. Ventilate is the term they have used. Previously PPV was the term used in 8th edition. Now they have changed it to ventilate. Next major change is, here previously 1 minute was used for target oxygen saturation table. Here they have changed it to 2 minutes. It starts from 2 minutes. Now we will see what are the major changes they have done in 9th edition. They have added birth and initiate cord management plan as actions in the first minute. See here, birth and cord management plan were not specifically mentioned, but here birth and initiate cord management plan have been added. They have removed suction. They have removed suction from warm, dry, stimulate position the airway. Suction only if needed is added here. Clean airway if only needed. See the change. Then the next change is terminology updates to be consistent with American Heart Association and ARB guidelines. This term, the ventilation, is preferred now than PPV. Positive pressure ventilation is changed to ventilation here. It then deferred cord clamping duration increased to at least 60 seconds. So previously, for most vigorous preterm newborns, the current evidence suggests that clamping should be delayed for at least 30 to 60 seconds, but here they have clearly mentioned it should be at least 60 seconds. Among vigorous term newborns, the evidence suggests that a similar delay may be reasonable. But here they say if you are planning delayed cord clamping, it should be at least 60 seconds. Then the next change is umbilical cord milking. Previously, for newborns less than 28 weeks gestation, umbilical cord milking is not recommended because it has been associated with an increased risk of intraventricular hemorrhage. But here, so the next change is regarding umbilical cord milking. For non-vigorous term and late preterm newborns, may be a reasonable alternative to early cord clamping. So in these babies, you can do umbilical cord milking. For term and late preterm newborns between 35 to 42 weeks gestation who remain non-vigorous despite of stimulation, milking the intact umbilical cord from the placenta towards baby may be a reasonable alternative. They are saying now this should be implemented. For non-vigorous preterm infants born between 28 to 34 weeks, there is not enough evidence to recommend this routinely. But in preterms less than 28 weeks, it is not recommended as it is associated with increased risk of intraventricular hemorrhage. It remains same as previous guidelines. But in newborns between 35 to 42 weeks, you can try umbilical cord milking. Then the next change is regarding the target oxygen saturation table. This 1 minute is been removed now. We have to start recording from 2 minutes onwards. The saturations remain same, but you have to note it from say 2 minutes onward. Then the next change is regarding the oxygen concentration or FiO2. Initial oxygen concentration for preterm infants is further broken down to identify levels for 32 to 34 weeks of gestation and gestational age less than 32 weeks. So for more than or equal to 35 weeks of gestation, initial setting from 21% of FiO2. Then for 32 to 34 weeks of gestation, you have to start from 21 to 30% FiO2. For less than 32 weeks, you have to start from more than or equal to 30% FiO2. Then the next change is regarding the ventilator rate. Target is expanded to 30 to 60 breaths per minute. The ventilation rate previously was 40 to 60 breaths per minute. Now it has come down to 30 to 60 breaths per minute. Regarding the PIP, peak inflation pressure, has been simplified 25 centimeters of water with an acceptable range based on the gestational age. Previously, it was start with a PIP of 20 to 25 centimeters of water. Now it has suggested to initial PIP is 25 centimeters of water. For more than or equal to 32 weeks, you have to start from 25 to 30. Less than 32 weeks, 20 to 25 centimeters of water. Now the next change is time period extended to 15 to 30 seconds before beginning the ventilatory corrective steps. If the heart rate is not increasing within 15 to 30 seconds of starting ventilation and you do not observe chest movements, right away start ventilatory corrective steps. Next change is ventilatory corrective steps may be performed in the order most likely to be useful. You should not follow the same corrective steps like MR SOPA. You can correct any step you think that is needed. You may choose the step that is most likely to be the helpful and prioritize the order in which you perform them. Next change is a laryngeal mask airway. A laryngeal mask airway may now be used as a primary device for ventilation instead of as an alternative airway when face mask and intubation are unsuccessful. This is the change. This is the change. Ventilation is initiated with a face mask or laryngeal mask. Then the next change is endotracheal tube size table has been adjusted, including the less than 800-gram newborn also. The weight cutoff for a 2.5 mm tube has been increased to 1200 grams and 3 tube to 2.2 grams. See here, for less than 800, you have to take 2.5 size tube, 800 to 1200 2.5 size. For more than 2.2 kgs, you can use 3.5 ET tube. And the next change is endotracheal tube depth is measured by the anterior edge of the baby's upper gum in the midline instead of the lip. So you will use the anterior edge of the baby's upper gum in the midline, not the lip, for depth of the ET tube. So these are the changes that have been made in the latest NRP. 13 changes have been made. Hope this was helpful. Thank you.